Hello, my name is Charelle Carter Brooks, and I'm a urogynecologist at George Washington University, Medical Faculty Associates, and the hospital. Today, I'm going to be talking to you all about the hidden medical epidemic, pelvic floor disorders. Many of us have not heard of pelvic floor disorders or what a urogynecologist does, so I'm happy to introduce this to many of you today. So, what is a pelvic floor disorder? A pelvic floor disorder is any condition that affects the pelvic floor. As you can see here in this picture on the left-hand side of your screen, there is a bony pelvis. So your hips are up here on both sides, your spine and your tailbone are down here, and in the front here is your pubic bone. This is a bowl of muscles that's attached to your bony pelvis, and that's where all your organs sit. And for women, that includes your bowels, your bladder, your womb, or your uterus, all sit on this bowl of muscles. And those bowl of muscles acts as support, as like a sling or a hammock to lift up those organs. If that muscle is injured, such during such things as childbirth, weight gain, just with age, those muscles can become weaker. That leads to damage or injury and can cause a pelvic floor disorder. And this is an example here. You can see another angle. So again, the bladder, uterus, rectum, and there's a little group of muscles here, our pelvic floor, which supports all those organs. After childbirth, weight gain, age, those muscles begin to sag, and so do the organs. And that's how we get a pelvic floor disorder. So, what exactly are there? There's three main types of disorders, and that includes urinary incontinence, which is involuntary leakage of urine, pelvic organ prolapse, which is when the uterus, bladder, or bowel drop, causing a bulge through the vagina into the vaginal canal or actually outside of the body. And there's fecal incontinence, which is the accidental leakage of gas or stool. And these are the three main disorders that we think of as encompassing pelvic floor disorders, but there are actually many more. This is a very common condition. 1 in 4 women will develop one of these problems. So, again, urinary incontinence, fecal incontinence, or pelvic organ prolapse in their lifetime. And just to put that in perspective, 1 in 3 women will develop diabetes in their lifetime. 1 in 8 will develop breast cancer, and 1 in 4 will develop heart disease. So, as you can see, pelvic floor disorders are just as common as some of the other conditions we commonly hear about in terms of women's health care. And that's why it's a hidden epidemic, because we don't hear about pelvic floor disorders very often. The Chicago Tribune, the Washington Post, many news outlets have been talking about this hidden medical epidemic. And they talk about how women have not previously been able to talk about them, but now are willing to talk about them. And I think it does women a disfavor to say that they weren't willing to talk about them before. I think there are a number of things leading to women not receiving treatment for pelvic floor disorders or not being able to openly discuss them with people. And I think some of the reasons that women do not seek treatment are they're embarrassed by their symptoms. They feel a sense of shame, and that making them not want to discuss it. They assume that, oh, leaking urine is just a natural part of aging. It happened to my mother. It's going to happen to me. I just have to deal with it. That's what the pads are for in the store. They're unaware of the treatments. So it's really easy, like I said, to go to the store and grab a pad, but you may not know what else is out there for you. And access issues. Maybe you don't know that there's actually treatments or doctors like a urogynecologist who treat these conditions. And many women, they do bring their symptoms up to their doctors quite often, or whoever they're seeing, and their symptoms are minimized or dismissed. We tell you, oh, it's not a big deal. It's not as serious as your diabetes or your heart disease. Wear a pad, it will be fine. Or you tell us and we say, okay, well, let's see you next year and see what happens with your symptoms, and don't really give you any treatment options or idea of how this is going to progress or not. It's a quality of life issue. So sometimes when issues don't hurt us, they're not prioritized like some of our health conditions. But quality of life is actually very important and can make other more serious health conditions worse, like depression, hypertension, etc. This is my new normal. Women often say, okay, well, I've had a few kids. This is just how things are going to be. They don't always have to be like that. And us as providers, we shouldn't tell you that that's the new normal. We should give you options. And oftentimes, when women go through menopause, stop having periods, have stopped having kids and pap smears, they no longer have pelvic exams. And pelvic exams are a really great way for kind of providers and patients to broach topics sometimes that are uncomfortable or otherwise difficult to talk about. And so, risk factors for these conditions include age, so getting older, and that's just the tissue weakens with time, but also going through menopause, your estrogen levels decrease, and that increases the risk of pelvic floor disorders. Weight gain, because that puts more pressure on that pelvic floor, weakening those muscles. Childbirth, there's a number of different things to the pelvis and the pelvic floor, but can result in injury. And that's if you have a vaginal delivery or a C section, they can both experience injuries. Genetics. So maybe you have a family predisposition or some type of connective tissue disorder where you're more likely to have these conditions. Also, the urinary symptoms tend to run in families like mom, sister, father, grandfather, who have a lot of urgency frequency symptoms. We see that passed down to their children. And finally, having pelvic surgeries like a hysterectomy that actually can increase your risk for some of these conditions. And many women don't realize that at the time of having their surgery. And so, what are some other bladder issues that women can have? I did talk about leakage, but that leakage of urine or incontinence can happen during exercise. It can also happen with coughing, laughing, or sneezing. Women can have frequent urination where you're always going to the bathroom and it's disruptive to your life at work, at home. Nighttime urination where you're waking up to go to the bathroom. Waking up at night to go to the bathroom is not necessarily normal, but we think of it as a problem if it's one or more times, especially if it's disrupting your sleep or you're having falls. If it's increasing your daytime sleepiness, it can be a problem. Incomplete bladder emptying. So you go to the bathroom, then you feel like you have to go again. You go to the bathroom, you feel the urge to go, but then nothing comes out. A weak stream, not being able to initiate that stream, those are all signs of incomplete bladder emptying. And finally, a loss of bladder control. You put that key in the door and you can barely make it to the bathroom. You're washing your hands in the sink. You get that strong urge. It's hard to control, or you're out in the cold weather, or you're drinking certain things. All of those things sometimes can precipitate a loss of bladder control. Bowel issues. So, issues women experience are hard stools, straining to empty, straining to have that bowel movement, a bulge when they have a bowel movement. Sometimes that bulge has to actually be pushed back inside, or you have to push actually on your bottom or your perineum to be able to have a bowel movement. You're passing gas or stool at times when you don't want to and you can't control it. When you go to the bathroom the next time after a bowel movement, you've noticed that there's some soiling on your underwear or your pad or when you wipe. Or again, you're on the bathroom having a bowel movement and you go, but you feel like you didn't empty all the way. All of these things are bowel issues related to your pelvic floor. And pelvic floor issues, kind of a catch all here, but pain with sexual intercourse, vaginal or rectal pressure, a vaginal bulge, vaginal dryness, pelvic floor weakness, and childbirth injuries all fall into the category of pelvic floor disorders. And these can affect the quality of life. So they can lead to depression, excessive worrying, anxiety, social isolation because you're scared to go outside. You never know when you're going to have an accident or you're having discomfort from that bulge. And it can lead you to stay sedentary, not being able to exercise, gaining weight, and worsening the depression. Quality of life issues are very important and should be taken just as seriously as issues such as hypertension, diabetes, heart disease. So now I'm just going to spend a few minutes very quickly going through some of the treatments we have for urinary incontinence or urinary leakage. So there's two types of incontinence. One is stress incontinence, and that's when you leak with coughing, laughing, sneezing. And one is urge incontinence. That's that gotta go, where you feel like you've lost bladder control and then you have an accident. But many women have both of these together. And so sometimes in the office, we do an exam, a pelvic exam, of course, but we have to do special office testing like urodynamics or cystoscopy, which is a camera in the bladder, to make sure that nothing else is going on or to help me further evaluate your symptoms to decide what the best treatment is. First line treatment for all of these happen to be behavioral intervention, so training the muscles of the pelvic floor. And we work with trained specialists called pelvic floor physical therapy. Yes, you can do physical therapy for your pelvic floor. It's actually great, and probably everybody should do it, especially if they've had children. Decreasing your fluid intake, changing some of your diet, working on the bladder training, timed voiding, so going to the bathroom on a schedule, and weight loss are kind of our first line interventions. And this can result in a 50% decrease in your symptoms. Second line treatments include medications or pills, which work to relax the bladder wall during filling so you can hold more urine, have less urinary urgency, less frequent urination, and about, again, a 50% improvement when you add the medications. And then there's third line procedures, acupuncture for the bladder, bladder Botox, like people get in their face. You can also get that in the bladder. It works really well. And then a little pacemaker that I can implant to help give you better control over your bladder. These are all treatments for urge urinary incontinence, or that feel like you need to go when there's a strong sense of urgency. And then there's treatments for the stress incontinence. So all the behavioral and pelvic floor physical therapy we can do for that leaking with coughing, laughing, sneezing. But there's also little inserts that we can place in the vagina and teach you how to insert and take out yourself and clean and replace, that help to support the bladder and prevent leakage. And those are called pessaries. And then there's a surgery for stress incontinence. And one of the gold standards is something called the mid-urethral sling. It's a very short surgery done in the surgery center that provides support underneath the urethra. So when you cough, laugh, or sneeze, urine can't escape. It works very, very well. And then briefly on to prolapse. So pelvic organ prolapse is a common condition. And it's, again, when that pelvic floor becomes very weak and we get a descent of organs such as bowel, bladder, or uterus into the vagina, basically like a hernia for women. And you can feel a vaginal bulge or vaginal pressure, or like something has dropped. You may notice it more with exercise or straining on the toilet. Pelvic floor physical therapy is one of the mainstay treatments. Again, you're working with that specialized therapist to do these pelvic floor muscle exercise, increase your strength, endurance, and coordination of those pelvic floor muscles to improve support. Other things women can do to stop, to treat prolapse or prevent it from getting worse, is to stop smoking, avoiding constipation, and avoid heavy lifting or pulling. A pessary, again, these vaginal inserts are used for stress incontinence, but also pelvic organ prolapse. And if you remember diaphragms, they are kind of put in like and fit like a diaphragm, and you can manage it yourself. And these are very, very low risk interventions that women can choose if physical therapy or surgery is not a great option for them. Finally, surgical management. So just so women know, many, many surgeries are performed for prolapse every year in the United States, upwards of 200,000 surgeries. It's one of the most common surgeries performed actually in the United States. And about 13% of women will undergo surgery for prolapse or for another pelvic floor disorder in their lifetime. So it's pretty common. And kind of briefly overview the procedure types. There's vaginal surgeries where there's no incisions on the belly, and minimally invasive surgery where you use laparoscopic or robotic instruments that are the size of a little tiny keyhole through the belly. These surgeries are both minimally invasive and result in very little blood loss. Women are able to go home the same day. The recovery period is 6 weeks, but oftentimes less because of these innovative techniques. And the complication rates are very low as well. While the surgeries do take some time to perform, anesthesia has really been modernized recently. And so there's not a lot of effects from the anesthesia like there used to be. And women have pretty good pain control and not much nausea after the surgery. And I can either use mesh or no mesh to help augment the surgery if needed. In conclusion, what I'd like you all to take home is that pelvic floor disorders are very common, and being a woman is really a risk factor for having them based on our anatomy. And these symptoms can increase with age. There's also a number of treatment options that exist. And I think the main thing is that you do not have to suffer in silence. There are treatments and there's options. And even if you don't want treatment, sometimes just knowing what's out there can be helpful. And what I tell most women is you don't have to live with a pad. There are definitely treatments for you. Thank you very much. And again, I'm Charelle Carter Brooks at GW. If you would like to reach out and have any questions, you can email me at urogyn@mfa.gwu.edu. And my office phone number is 202-741-3100. What I didn't put on here is you can follow me on Instagram or Twitter at Charelle_MD. Thank you.
Thank you so much, Dr. Carter Brooks.